Hi, pleasant day to each and everyone. I'm Dr. Mikhail Nasyambuhay. I'm Dr. Miko or Dr. Mix. Our lesson for today will all about the skeletal system, and the skeletal system is composed of 206 bones, and we'll discuss hopefully all of them in one session and be able to appreciate their classifications, their functions, and also we'll tackle on the different joints and their classifications. The skeletal system is made up of different types of bones, and we have 206 bones in an adult, and each of these bones is made up of different types of tissues, including the bone or osseous tissue, the cartilage, the dense connective tissue, the epithelium, adipose tissue or fat, and the nervous tissue. The entire framework of bones and their cartilages is referred to as the skeletal system. And when we study about the bones and their structure, we refer to it as studying osteology. The skeletal system has the following functions. First is for support. The skeleton or the different bones in our body serve as the structural framework. So when we say framework, what does it mean? So it serves as the main structure that other structures in the body attach to. What are the other structures? Most skeletal muscles or even the tendons attach to the framework or the bones. So this is to support the whole body. Next is protection. The skeleton or the different bones house or protects the different internal organs in our body. For example, the cranial bones in our head, they protect the brain from external damage or trauma. The ribs, for example, protect the heart, our lungs. Imagine if we do not have the skeletal system, then thus external factors such as maybe uh, trauma or just a little push will cause already damage to our hearts and lungs. The third function is to assist in movements. Most skeletal muscles are attached to the bones. So when muscles contract or when they shorten, because they are attached to the bones, uh, the body can move. Okay, so the skeletal system assists in movement. The next function is for mineral homeostasis. So what do we mean by homeostasis? We maintain the balance that is needed for our body to survive. Okay, so bone tissue stores several minerals, including calcium and phosphorus, which contribute to the strength of the bone. So the tissue releases or stores these different types of minerals. Accordingly, when the body needs to store or when the body senses that this type of mineral is decreased, then they will release the stored mineral to maintain the balance or homeostasis. Next is for blood cell production. So in specific types of bones in our body, not all, but there are these bones that have a connective tissue that we call red bone marrow. What is this red bone marrow? The red bone marrow produces red blood cells, white blood cells, and platelets. So through a process called hemopoiesis. Hemo means blood, poiesis means making. So hemopoiesis is the making of blood. And the different bones included in the body that have red bone marrow. So we have uh, the developing bones of the fetus. And in adults, these red bone marrow can be found in pelvic bones, the sternum, the vertebrae, the skull, and even the ends of our upper and lower bones, including the humerus and the femur. And last but not the least, the bones are for triglyceride storage. We mentioned about red bone marrow in the blood cell production. In triglyceride storage, we talk about the yellow bone marrow, which consists mainly of adipose tissue. And these adipose tissues or fats store triglycerides. And later on, we learned that the stored triglycerides are potential chemical energy reserve used in the body when needed. So in this picture, you could appreciate the different bones that comprise the rib cage, including your sternum. This is your sternum or breastbone, comprising your manubrium, the body of the sternum, and the xiphoid process, and the different ribs attached to your vertebrae at the back, and they attach through different cartilages in front to form the rib cage. All in all, we have 12 ribs that you can see here and appreciate protecting the lungs, even the diaphragm, which is the muscle that is responsible for our breathing, and your heart is also found here. So in this picture, I want you to appreciate the function of protection of your bones, particularly the rib cage. We have different types and classifications of bones, and they are classified according to their shape and size. And the shapes of the different bones will tell us largely about their function. So what are these different classifications or types? We have long bones like the humerus, short bone like the trapezoid in our wrist, flat bone like the sternum, and irregular bone like the vertebrae in our spinal column, and the patella in our knees, a sesamoid bone. The long bones are longer than wide, so such as the thigh, leg, arm, forearm, fingers, and toes. So the different bones found in these areas are long bones. Short bones are described as bones that are almost cube-shaped. Most are found in our wrist and ankle bones. Flat bones are thin and has an extensive surface, such as the cranial bones, the sternum, the ribs, and our scapulas of our back. And we have irregular bones. They do not fit the above categories, such as the vertebrae and some facial bones. And we'll appreciate more the irregular bones by the name irregular. They really have irregular shape. Here is a table that would summarize the different classifications of the bones according to their shape and their function. And we have the examples of the different bones that are classified to the following types: the long, the short, the flat, irregular, and sesamoid bones. We have two divisions of bones in the skeletal system. These two divisions are one, axial, and two, or second, appendicular. The first division is axial. These include the bones that are around the body axis, particularly bones that are at the center. So these bones include the skull, the hyoid found in the neck, the ribs, the sternum, and the vertebrae. While the second division is the appendicular. These are bones of the upper and lower limbs, plus shoulder and hip bones that connect them. So these bones include the collarbone or clavicle, the arm or the humerus, the forearm, including your radius and ulna, and your thigh bone, the femur. So as mentioned, we have two divisions of the skeleton, axial skeleton and the appendicular skeleton. Axial skeleton are the bones that are in color blue. So we have 80 bones that comprise the axial skeleton, including the skull, the hyoid bone, auditory ossicles, vertebral column, and the thorax. While in your appendicular skeleton, we have 126 bones. So 80 plus 126 equals 206. So in an adult skeleton, we have 206 bones all in all. So the bones that are in color blue are in this part is your appendicular skeleton, including your pectoral or shoulder girdles, including your clavicle over here, and the scapula at the back. The upper limbs, your humerus, radius and ulna, carpals, metacarpals, and phalanges. And we have your pelvic girdle over here, including the hip, pelvic, and coxal bone. Then we have the bones of the lower extremities, the humerus, the femur, the patella, the tibia and fibula, tarsals, metatarsals, and phalanges. Don't worry, we'll be discussing each of these bones in a while. So this is a summary of the axial skeleton and the appendicular skeleton. In this particular slide, the ones that are in color blue are the bones belonging to your axial skeleton, and the ones that are not in color blue are bones that belong to your appendicular skeleton. So appreciate the axial skeleton at the center and the appendicular skeleton comprising the different bones that attach themselves at the center, attach themselves to the axial skeleton. The skull or the bone of the head has 8 cranial bones, including the frontal, 2 parietal, 2 temporal, occipital, the sphenoid, and ethmoid bone. And the skull has 14 facial bones, including the 2 nasal, 2 maxilla, 2 zygomatic, 2 lacrimal, 2 palatine, 2 inferior nasal concave, 1 mandible, and the 1 vomer bone. Here is a picture of a skull at an anterior view. The skull consists of cranial bones and facial bones. The 8 cranial bones, cranial, the crown, the upper part of the skull, and we have the facial bones over here. So we have the frontal bone here, the parietal bone, the temporal bone. We'd be able to appreciate more of the uh, cranial bones in a sagittal view or lateral view. And then the facial bones. So we have the nasal bone over here, the maxilla, the zygomatic bone. Okay, so we have here the uh, lacrimal bone, the palatine bone, the vomer, the inferior nasal concave, and then the mandible over here that makes up the jaw. Here is a picture of the right lateral view of the skull, and we would be able to appreciate the cranial bones, including your frontal bone over here, parietal bone, temporal bone, and the occipital bone. And appreciate more the structures of the facial bone, the nasal bone over here, the zygomatic bone, the maxilla, and the mandible. Notice the zygomatic arch over here. So the zygomatic arch, this one, is formed by the zygomatic process of the temporal bone. This is your temporal bone. This is the zygomatic process of the temporal bone. And the zygomatic arch is also formed by the temporal process, this one, temporal process of the zygomatic bone. So the zygomatic arch is made up of the structures of the temporal bone and the zygomatic bone. Okay, the temporal process and the zygomatic process. A superior view of the skull. Let's get oriented with the picture. This is the anterior front part, posterior back part, right side, left side. So you would be able to appreciate the frontal bone, the parietal bones separated from one another by the sagittal suture. We'll talk about this suture, which is a joint. And then you have here the occipital bone, the posterior cranial bone of the skull. Here is a medial view of the sagittal section of the skull. So we are seeing from the inside, and we would be able to appreciate more the structures and what's their shape of the cranial and facial bones of the skull. I want to take uh, note of the ossicles over here. Okay, the ossicles are the bones, small bones found in the middle ear. Okay, the middle part of the ear. So these are your malleus, incus, and stapes. Okay, malleus, incus, and stapes in layman's term are referred to your hammer, anvil, and stirrup. Okay, they are named accordingly, hammer, anvil, and stirrup because of their shapes. The malleus looks like a hammer, the incus looks like an anvil, and the stapes looks like a stirrup. And so be able to appreciate that the brain would be here. And then we have different sinuses, air filled cavities. And then we have the nasal part over here. Then the mandible over here. Here is a posterior-inferior view of the skull. So posterior and inferior view. So you'll be able to appreciate the parietal bones, the sagittal suture over here. So you have the occipital bone, and you have here the external occipital protuberance. Actually, these protuberance are like the bulging. You could try to palpate or feel for this protuberance at the back of your head. Okay, so that's the external occipital protuberance. And you'll be able to also appreciate the different structures of the face at this view over here. So we have here the inferior view of the skull. This is a view like a camera view coming from below. So we have here the anterior or front. We have here the posterior or back, and then we see it from below the skull. The mandible here or the jawbone is removed. So we see the upper set of uh, teeth, the part of the maxilla. Then we have here the vomer, and then the occipital bone, then the temporal bone over here. So there's a big hole here, a big foramen. We call it your foramen magnum. Okay, so particularly in this area, we would appreciate the starting of your spine and the connection of which to your brainstem. Okay, brainstem. So this is the biggest foramen of the head. When we say foramen, it's like a passageway or a hole in the skull, or a hole in a particular bone wherein different structures pass through. So this is a superior view of the sphenoid bone in the floor of the cranium. And we'd be able to appreciate the sphenoid bone over here and be able to see that in these different structures, the occipital, sphenoid, we have different bones that have different foramen. Again, when I say foramen, it's like holes in a particular structure, or in this example, holes in the bones where in different structures pass through. It could be an artery, passageway of blood or vein, or nerves, or even other structures. So here is your sphenoid bone in color green. So this is your sphenoid bone with a different foramen, and it has a lesser and a greater wing, and also has the optic foramen, the foramen rotundum, the body of the sphenoid, and the pterygoid processes. So we have here the medial view of a sagittal section of the head, and let's pay attention to your ethmoid bone over here with the different structures of the ethmoid bone. So I just want you to take note of the ethmoid bone that is located deeper as compared to your superficial bones over here. So it's deeper. And then it also has your superior and middle conchae. Okay, superior nasal concha over here and the middle nasal concha over here. So these particularly make up the lateral wall of your nasal cavity. So this is your superior view of the ethmoid bone, and I just want you to note the different holes, the structure, and then we have the olfactory foramina here. Olfactory foramina because your nerves for the smell, okay, nerves for smelling or olfaction, the nerve responsible why we can smell a particular scent is your olfactory nerve. This is your cranial nerve number 1. So the different nerves of your olfactory nerve, cranial nerve number 1, will course through your olfactory foramina so that we would be able to identify a particular scent when introduced near our nose. Just continue to appreciate the different structures of the ethmoid bone in these particular pictures. The mandible is the largest and strongest facial bone. So the mandible is the bone of your jaw. So it has these particular structures: condylar process, the mandibular notch, the ramus or the body, the angle of the mandible, the body of the mandible, and then we also have the coronoid process over here, and this one, coronoid process, and the mandibular foramen. So what are the unique features of the skull? Sutures. These are lines that we have seen in the previous pictures. So the sutures are immovable joints between the skull bones. So we have coronal, sagittal, lambdoidal, and squamous sutures. The paranasal sinuses are cavities. Paranasal sinuses are air-filled cavities, and once they are replaced, the air-filled cavities are replaced with fluid. For example, in patients with sinusitis, uh, there would be a feeling that the head is heavy, no? And then these sinuses are located in bones near the nasal cavity. And then fontanas are also seen in the previous pictures, these are soft spots in the fetal skull. So fetal skull, the skull of the fetus or the newborn. Uh, Fontanelles are present to allow deformation at birth so that the head would be able to also pass through the vaginal canal and the bones. And then the fontanelles calcify or build up its density in an older stage or older age to form sutures. So fontanelles calcify to form sutures, and sutures are lines appreciated in the cranial bones. This is your nasal septum. The structures that form the nasal septum are the perpendicular plate of the ethmoid bone, the vomer, and the septal cartilage. So the nasal septum is the structure that divides your nasal cavities into two. It's found in the medial part. Okay, so your nasal septum, this is your perpendicular plate of the ethmoid bone, the septal cartilage, and the vomer. So your nasal septum is not only made up of bone, but it is also made up of cartilage because of the septal cartilage over here. Bones coming from the perpendicular plate and the vomer, and the anterior part is made of the septal cartilage. This is your nasal septum. The orbit or the eye socket. So your orbit is this one. So in a bigger picture, this one, the eye socket. So your eyeballs are located here in your orbit. So the orbit is a pyramid-shaped structure that contains the eyeball and associated structures. So your eyeball is here pyramid-shaped because this would be the base located more anteriorly and the apex of the pyramid would be located more posteriorly. So your orbit or your eye socket is made up of different bones of the cranial and the facial bones. So you have your frontal bone over here, zygomatic bone, your maxillary bone over here. Here is a table that shows the principal foramina of the skull. When I say foramen, I want you to think about holes or passageways located in the bone or in the skull. So we have different types of foramen and they are located in different bones of the head. And it's nice to know what are the different structures that pass through each foramina. Here are your paranasal sinuses, the ones in colors blue, green, red, and yellow. So these structures, the ones in these colors, are paranasal sinuses. These are mucous membrane lined spaces. So they are air-filled. Normally they are air-filled cavities in the frontal, sphenoid, ethmoid, and maxillary bones that connect to the nasal cavity. So the name of the sinuses are named according to the bones that they belong to. Blue one for frontal, yellow for the maxillary sinuses, red for the ethmoidal, and green for the sphenoidal sinuses. In normal states, the sinuses are air-filled. So air-filled because they make the head feel light. Okay? Once the air-filled cavities are replaced with mucus or the fluid that is made by the membrane in cases for allergy or infection. For example, like in cases once you uh, once dust irritates the lining, so mucus is produced, or once there's an infection because of colds or there's a virus affecting the upper airways. Okay, so uh, there is inflammation, and because of the air being replaced by fluid, the patient feels that the head is like heavy. Okay, and then the patient will have colds, okay, or rhinorrhea, fluid coming out of the nose. Anyway, if there is an infection of the frontal and maxillary sinuses, or if the patient has paranasal sinusitis, you just palpate or press on the frontal and maxillary sinus, and if it is warm and if it is tender or painful to touch, then it could help you in your diagnosis that the patient has sinusitis. Here in this picture, you would be able to see the drainage system of the sinuses. So in your in sphenoidal sinuses, it could drain through your the opening of the sphenoidal sinus over here in your uh, upper meatus near your upper concha, frontal sinus at the middle. Okay, middle meatus of the nasal cavity. So this picture, I just want you to know that if the patient has sinusitis, maybe it's common for some of you. That's the reason why you also have colds, because the mucus or the fluid produced in these sinuses will be drained towards your nose, and it will have a symptom like uh, nasal discharges. Okay? We discussed about fontanelles at birth, or soft spots of the fetal skull. So we have here an anterior fontanelle. Usually it is shaped like a diamond, but not really appreciated here. We have a posterior fontanelle. The shape is usually like a triangle. And we have an anterolateral fontanelle over here. And this will be the future sutures, the lines that separate the different cranial bones of the body or the skull. The hyoid bone supports the tongue, providing attachment sites for muscle of the tongue, neck, and the pharynx. So you appreciate here the hyoid bone. So what's special about the hyoid bone is it's a bone in the body, particularly at the neck part, that has no direct attachment or no direct articulation with other bones. So that's what is special about hyoid bone. There is no direct articulation with other bones. So we proceed with the bone that protects our spinal cord, the one that is located at the medial portion of our back, is your vertebrae or your vertebral column. So the functions of your vertebrae include enclosing the spinal cord for protection. It also supports the head, and the vertebrae serves as a point of attachment of different muscles of the back. It is also an attachment point for the ribs and the pelvic girdle. The vertebrae is made up of 33 different bones, 33 different vertebrae. So we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 1 sacrum, and 1 coccyx. So why 33? Because when we were younger, the sacrum is composed of 5 bones, and the coccyx is composed of 4 bones. 7 plus 12 is 19, plus 5 is 24, plus 5 from the sacrum, 29, and plus 4 from the coccyx equals 33 different bones that make up your vertebrae. The vertebral column is not straight, okay? it has curves, and these curves are for all in all, apat, and then there are cervical and lumbar curves that are convex, that bulge anteriorly, and thoracic and sacral curves that are concave, that bulge posteriorly. Why are there curves? Because these curves increase the strength and help in the balance and absorb shocks when present. Here is your vertebral column. The vertebral column is this one, all in all. The vertebral column is made up of 33 vertebra. Now, 33 vertebrae, plural. So, the vertebral column is made up of different segments. What are these different segments? The cervical segment, thoracic segment, lumbar segment, and the sacrococcygeal segment, or the sacrum and coccyx segment. The vertebral column is made up of 33 different vertebrae. 7 cervical, 1, 2, 3, 4, 5, 6, 7. 12 thoracic vertebrae, 1 to 12. And your ribs will have attachment points at these areas. Your lumbar vertebrae, 5. 1 sacrum and 1 coccyx. However, in a younger state, rudimentary or younger bones, your sacrum is made up of 5 fused sacral vertebrae. Your coccyx is made up of 4 fused vertebrae. Okay? In a anterior or a posterior view, the vertebral column may seem to look like it's straight, but in a lateral view, it has curves. The cervical and the lumbar segment have anterior convexity. They curve anteriorly, while your thoracic and your sacrococcygeal segments curve posteriorly, so they have anterior concavities. Okay, again, this is for strength and balance. So again, the vertebral column is made up of 33 different vertebrae with the following segments. Here is a vertebral column of a fetus. You'd notice here that the vertebral column is just a single curve, anterior concavity. This is your cervical, thoracic, lumbar, and sacrococcygeal segments. So just a single curve. But once the fetus grows into an adult, the body becomes larger, it increases in size, the bones also expand and they grow larger to compensate for the weight and for the balance. So curves are made. So again, there are 4 curves in an adult human being. You'll be able to appreciate here that there is what we call an intervertebral disc found in between each vertebrae, particularly in between the vertebral bodies of the vertebrae or our vertebral column. So we find intervertebral discs. Their function is mainly for shock absorption. So once there is an external force or external pressure that exerts effort to our vertebral column, they compensate as shock absorbers so that there won't be necessary or over pressure or trauma to our spine. So we talk about the structure of the vertebra. It has a body, the big portion of the vertebra. It's a disc-shaped anterior portion. We have a vertebral arch, posteriorly back from the body. So with the body, it creates a hole called the vertebral foramen. And we have 7 processes from this arch. So we have a transverse process extending laterally on each side. We have a spinous process extending dorsally or posteriorly. And we have 2 each of superior and inferior articular processes that form joints with vertebrae. So again, the structures of the vertebra consists of a vertebral body, a vertebral arch, and 7 several processes. So this is a vertebra, particularly this is a thoracic vertebra. Okay, a superior view of the vertebra. This is the anterior. This is the posterior part. So this is the vertebral body. This is the arch. Once the arch connects with the body, it forms a hole over here or a foramen. We call this your vertebral foramen. So your spinal cord is found in the vertebral foramen. And the arch has 7 different processes, and these processes extend from the arch. So we have 2 transverse processes that extend laterally. We have a spinous process that extends dorsally or posteriorly. And we have 2 superior articular processes. And we have 2 inferior processes not seen, but it's at the back area. Okay, so we have 7 processes all in all. 1, 2, 3, 4, 5, and then 2 inferior articular processes at the back. So this is a right posterolateral view of the articulated vertebrae. So we have 1 vertebra, the 2nd vertebra, and 3rd vertebra. Okay, so this is the body, and then the vertebral arch will be here, and then the processes will extend from the arch. Okay, so from the arch, it will have several holes or the vertebral foramen, and the foramen, once they connect to one another, will form a canal. Okay, so we call this your vertebral canal here, where your spinal cord is found. Now, when your vertebral foramen from each vertebra connect, they form your vertebral canal, where your spinal cord is located. Okay, how will you know if the position of the vertebrae using the body, the spinous process? So the body is always anterior or front. The spinous process is always pointing posteriorly, and it points inferiorly, posterior and inferiorly or downwards. Okay, so your arch is made up also of a rounded pedicle and a flattened lamina. Okay, rounded pedicle and a flattened lamina. The cervical area or the cervical vertebrae are from C1 to C7 because there are 7 cervical vertebrae, and the spinous process often are bifid, meaning there are like 2 heads with transverse foramina. When you say transverse foramina, there are like holes or passageways located in the transverse processes. C1 is called your atlas, and C2 is your axis. Your C7 is your vertebra prominence. Your C1, C2, and C7 cervical vertebrae are your atypical. Atypical vertebrae, meaning they are not the some sort normal vertebrae. Okay, there is something special with these 3 cervical vertebrae, C1, C2, and C7. Your C1 atlas articulates with the head. It has a specialized function to support the head, and it's special or it's atypical because it lacks a body and spinous process. Your C2 or axis has a body and spinous process. It's also called your dens, which means tooth, that creates a pivot for your head rotation. Okay, that's the reason why we can look towards the left and to the right and rotate our head at this manner because of the articulation of your C1 and your C2 cervical vertebrae. Okay, so this is your cervical vertebrae over here. So this is your vertebral column. The ones in color blue are your cervical vertebrae. Okay, your spinous processes are bifid. Okay, so like two heads, bifid. So this is your C1. It's also called your atlas. It's atypical or not the usual spinous, not the usual cervical vertebrae because it does not have a body and it has no spinous process. The body of the atlas is from your C2 or your axis. So this is your C2, your axis. So this part of the axis is called your dens. It makes up the body of the axis of the atlas. Okay, of the atlas. This is dense, or sometimes you call this your odontoid process. Okay, so this serves as the body of your atlas. So that's the reason why, just imagine your atlas moving from left to right. Okay, left to right. That makes up the ability of our head to rotate looking from the left to the right. Okay, and then this one is your C3, C4, C5, C6, and your C7 is also atypical. This is called your vertebra prominence because it has a prominent or prominent looking spinous process. Actually, when you reach for your back and locate for your C7 or your vertebra prominence, you would be able to appreciate the prominent spinous process of your C7 or your 7th cervical vertebra. Here is your C1 or your atlas. So it has no body. It is only formed by an anterior and a posterior arch. It has no spinous process. So this is a superior view of a typical cervical vertebra. Typical, the usual cervical vertebra. It has bifid spinous processes. It has a vertebral body and transverse foramen are located at the transverse processes. Okay, so this is your C2 or your axis. So this part here, the odontoid process or your dens, okay, will become the body of your atlas. Okay, and then it has also vertebral foramen over here and transverse foramen at the transverse process. Okay, so we have the thoracic, lumbar, sacrum, and coccyx. The thoracic vertebrae is from T1 to T12. They are larger than the cervical vertebrae and have facets for articulation with the ribs. That's why they are called your thoracic vertebrae because they have articulation points for the ribs that make up your rib cage. Your lumbar has 5 vertebrae, L1 to L5. It's the largest and the strongest. It has spinous processes that are short but are thick and they look like quadrangular. Your sacrum has S1 to S5 fused into one unit, and the foundation for your pelvic girdle is your sacrum, and they contain sacral foramina for nerves and blood vessels. And your coccyx, as mentioned, are 4 fused coccygeal vertebrae into one. Here in color blue would be your thoracic vertebrae. And as mentioned, they appear larger than your cervical vertebrae, and the thoracic vertebrae will have portions or processes that will serve as articulation points for your ribs. The head of the ribs will have an articulation with the superior and inferior demifacet of your thoracic vertebrae, and the tubercle of the rib will have articulation with this portion here. So this one is a facet for articular part of the tubercle of the rib. So here is your lumbar vertebrae. So the spinous processes of your lumbar vertebrae are shorter. However, their shape now are more quadrangular. Okay, more sometimes they're referred to as rhomboid in shape. Okay, then the vertebral bodies of your lumbar vertebrae appear larger as compared to your thoracic vertebrae. Okay, so since these are your lumbar vertebrae already, there won't be any processes or articulations with the ribs. Okay, so you'd be able to appreciate here the larger, the shorter processes, larger vertebral bodies, and uh, the intervertebral disc over here, which is present in in between each of the spaces in between your vertebral bodies. Here's a table comparing the major structural features of the cervical, thoracic, and the lumbar vertebrae. And if you notice the size, they become larger and larger. Okay, so the size is small, large, and largest. Foramina, particularly present in the transverse processes. Okay, transverse foramen here in your cervical vertebrae. Spinous processes, uh, short and blunt for your lumbar, and then the articular facets for ribs only present in your thoracic, and then direction of articular facets would be would be described as follows. And the sizes of your intervertebral discs, the disc found in between the bodies of your vertebral bodies, would be thick relative to the size of the vertebral body, thin for the thoracic relative to the size of the vertebral body, but thickest for the lumbar vertebrae. So let's discuss the sacrum and coccyx. So this part is your sacrum, and this one is your coccyx. 5 rudimentary vertebrae, meaning immature or the uh, unfused bones of your sacrum. 5, 1, 2, 3, 4, 5. But in adults, they already are fused as one. And you have 4 coccygeal vertebrae, 1, 2, 3, and 4. Okay, so these are your sacral foramen, anterior sacral foramen. This one is a posterior view because you would be able to appreciate the median sacral crest over here. Okay, the the vertebral foramen will fuse with the 5 sacral foramen and form your sacral canal. Okay, and then there will be a sacral cornu over here, sacral cornu, wherein the spinous processes were not able to fuse at the center. Okay, and then this would be your coccyx, like a pyramid or triangular shape, wherein you have a base and then an apex. Okay, let's discuss about the thorax. The thoracic cage is composed of the sternum, the costal cartilages, the ribs, and the bodies of your thoracic vertebrae from T1 to T12. The sternum is formed by three portions fused by about age 25. The three portions are your manubrium, the body, and your xiphoid process. There are 12 ribs. The first 7 ribs are your true ribs because they articulate directly with the sternum through their costal cartilages, while the false ribs are ribs 8 to 12 because they do not articulate with the sternum directly by costal cartilages. Actually, the 11th and 12th ribs are called your floating ribs. However, they also are classified as your false ribs because they do not articulate with the sternum directly. They are floating because I'll show you a picture in a while. The bones of the thorax enclose and protect organs in the thoracic cavity and in the superior abdominal cavity. So there are structures inside the thoracic cage, and particularly the heart, the lungs, the diaphragm, and also the upper portion of the abdominal cavity, including the liver over here. Okay, so the following structures comprise your thoracic cage. So let's talk about the manubrium, the body, and the xiphoid processes that make up your sternum. Okay, so this is your manubrium, the sternal body, and your xiphoid process. And again, as mentioned, the thoracic vertebrae, the T1 to T12, are vertebrae that have articulations with the rib. The first 7 ribs, 1, 2, 3, 4, 5, 6, and 7, will have their costal cartilages directly articulating with the sternum. That's the reason why your first 7 ribs are your true ribs, while your ribs 8, 9, 10, 11, and 12 are your false ribs because their costal cartilages, particularly for your 8, 9, and 10, their costal cartilages will only articulate with the cartilages above them. Okay, so not directly articulating with the rib. Your ribs 11 and 12 are your floating ribs because they're just floating, no articulation with the sternum or the costal cartilages above them. Let's talk about the ribs. Each rib articulates posteriorly with its corresponding thoracic vertebra. So here is your rib. It has a head, neck, a tubercle over here, and a costal angle, costal groove. And this one is already at the anterior portion. This one is a posterior portion. Anterior portion because this is a facet for your costal cartilage that will articulate anteriorly with your sternum. This side here will articulate with the superior and inferior facet of your thoracic vertebra posteriorly. So here you could see a posterior view, the spinous processes of your thoracic vertebrae. Here you could see through the transverse process. The transverse process has been removed so that you will be able to appreciate more the articulation of the tubercle and the head of the rib. Okay, rib articulation with the rib at these portions, the tubercle and the head with the different parts of your thoracic vertebrae. And it will course anteriorly, then there would be articulation with your costal cartilage and articulation with your sternum. Okay, so from posterior, lateral to anterior. So here is a superior view of the left rib articulated with the thoracic vertebra. Superior view. So here is your rib with your thoracic vertebra. So the tubercle of the rib will have a facet for the transverse process of the thoracic vertebra over here, and the thoracic vertebra will articulate with the rib with the facet for the tubercle of the rib. So they meet at this portion over here. And the head of the rib will have an articulation with the demifacet, superior and inferior demifacet uh, of the bodies found in your thoracic vertebrae. Here's a picture of a herniated disc or a slip disc. So most often, the nucleus pulposus herniates posteriorly. Let's get oriented with the picture. This is anterior, this is posterior. Remember the intervertebral disc that I mentioned a while ago that is found in between the vertebral bodies of the vertebrae that act as shock absorbers? So the intervertebral disc is made up of the annulus fibrosus and the nucleus pulposus. However, when we become older, the intervertebral disc becomes more dense and they somehow get dried up. And then because of external forces or maybe wrong positions or switching of the positions in our vertebral column, there will be increase in the tension and pressure resulting to herniation or the moving of the nucleus pulposus uh, to areas that they should not be normally found. Okay, so in this portion over here, nucleus pulposus herniated posteriorly into the vertebral foramen, causing increase in pressure exerted at the spinal cord. Here are abnormal curves of the vertebral column. So an abnormal curve is the result of exaggeration of a normal curve. So in scoliosis, the exaggerated curve is towards this side, either right or left, okay, lateral. While in kyphosis and lordosis, the exaggerated curve is either anterior or posterior. Once there is like an exaggerated arching of the thoracic curve, then there would be kyphosis, the kuba. Okay, while in lordosis somehow it's quite the opposite of your kyphosis because it's like the overextension or the arching back of the lumbar vertebrae, lordosis. In some cases, there could be combination of these abnormal curves like in kyphoscoliosis wherein there is an exaggerated curving of the patient who is like arching forward and at the same time has an abnormal curve towards the lateral portion, kyphoscoliosis. Now we're ready to discuss on the appendicular skeleton of the skeletal system. First on the list is your pectoral girdle. Its function is to attach bones of the upper limbs to axial skeleton, and it is composed of clavicles and scapulas bilaterally, left and right. So here's your pectoral girdle, colored in blue, the clavicle, and your scapula. So this is an anterior view, this is a posterior view. Anterior view, you would be able to appreciate here your clavicle, having articulation with your sternum, making the sternoclavicular joint, and articulating with the acromion of your acromion of your uh, scapula, making the acromioclavicular joint over here. So this is your scapula and your clavicle. Posteriorly, you'd appreciate more the scapula with the blade of the scapula, the superior angle and the inferior angle of your scapula. Okay, then the blade will course anteriorly, forming the acromion of your scapula, joining with your clavicle. This is your right clavicle. The clavicle articulates medially with the manubrium of the sternum and laterally with the acromion of the scapula. So this is your clavicle. It's like somehow S-shaped. So medially, it articulates with the sternum, the manubrium part of the sternum. That's why this is your sternal end. It's more round as compared to your lateral end of your clavicle, which is somehow more flat. Okay, flat. laterally acromial end, more round sternal end. The acromial end articulates with the acromion of the scapula. That's why it's called your acromial end. Sternal end because it articulates with the sternum. This is your right scapula. So the glenoid cavity of the scapula articulates with the head of the humerus to form the glenohumeral joint, which is your shoulder joint. Okay, so where is this glenoid cavity? So this is your glenoid cavity over here. This one. Glenoid cavity over here. So your glenoid cavity articulates with the head of the sternum. Head of the humerus, I mean. Okay? So glenoid cavity over here. You will know that the view is posterior rather than anterior regarding the scapula when you see the smooth shape of a smooth surface of the subscapular fossa as compared to having the spine, the spine of your scapula over here. Anteriorly, it will have a coracoid process, and then posteriorly, okay, it will have the acromion coming from the spine of your scapula. Now we're ready for the upper limb or the upper extremity. The humerus is your arm bone. It articulates with the scapula through the glenoid cavity at the shoulder joint, and it articulates with the radius and ulna at the elbow. The ulna is the medial bone while your radius is the lateral bone, the thumb side. Because in a normal anatomical position, the thumbs will be pointing laterally or towards the sides. Okay, so your radius is found at the lateral area, so that is your lateral bone. Your ulna is the medial bone at the forearm. This is your right humerus over here. This is your arm, forearm. Your arm has the humerus. Your humerus is the arm bone. This is an anterior view of your right humerus. This is a posterior view of your right humerus. At the distal end of your humerus, you have a medial and a lateral epicondyle. And you have here at the proximal end of your humerus, you have the anatomical neck of the humerus and a surgical neck of the humerus. Greater and lesser tubercle, and in between you'd be able to see and appreciate here the intertubercular sulcus or groove. Okay, let's jump to the forearm. Arm, humerus, forearm, radius, and ulna. Normal anatomical position, the thumb will be pointing laterally or outwards, and you would be able to appreciate the thumb as the lateral side, wherein your radius will be your lateral bone and your ulna will be your medial bone. This is anterior view. This is a posterior view. Your humerus will have articulation with both radius and ulnar bones. What are the articulations formed by the radius and ulna? Let's get oriented with a picture over here. This is your humerus, the arm. This is your forearm. This is your radius, your ulna. Radius, lateral, ulna, medial. So the elbow joint is formed by the articulations by two articulations. First is the trochlear notch of the ulna with the trochlea of the humerus. The humerus will have a trochlea, okay? So the trochlea will articulate with the trochlear notch of the ulna over here. And the head of the radius will articulate with the capitulum of the humerus. So this forms your elbow joint. Okay, radius, ulna. So this is a lateral view of the proximal end of your ulna. So it has a trochlear notch. This portion over here articulate with the will articulate with the trochlea of your humerus. So the inferior view of the distal end of the radius and ulna. These portions over here will articulate with your carpals. Let's discuss about the wrist and the hand. Your carpus or your wrist is composed of 8 bones or your carpal bones. Then you have metacarpals, 5 bones of palm of hand, number 1 to 5 starting with the thumb. And then you have 14 bones of fingers, which are your phalanges, number 1 to 5. Each finger, except the thumb, has proximal, middle, and distal phalanges. The thumb lacks the middle phalanx, so in short, it has only the proximal and distal phalanges. Okay, let's discuss about the right wrist and hand. The skeleton of the hand consists of the proximal carpals, the intermediate metacarpals, and the distal phalanges. So carpals, metacarpals, and phalanges. Carpals, metacarpals, and phalanges. Okay, so let's start with the carpals. We have 8 carpals. Particularly, I use the mnemonic, "She looks too pretty, try to catch her." So mnemonic is being used that you make so that you would be able to somehow have an acronym or a phrase that will help you memorize the structures. For me, it's "She looks too pretty, try to catch her." So what are the carpals? Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, hamate, and your capitate. Okay, and hamate. So 8 all in all. And you have your metacarpals, 1, 2, 3, 4, and 5, starting from the uh, thumb. And then for the phalanges, you only have 14 because 3 in each finger, but in your thumb, you only have a distal and proximal phalanges. Okay? Proximal, middle, and distal for the second, third, fourth, and fifth fingers. The pelvic girdle or your hip girdle includes 2 hip bones, okay, or your coxal bones. It's joined anteriorly at the pubic symphysis and posteriorly it's attached to the sacrum at the sacroiliac joint. So it looks like a basin. So a basin-like pelvis is formed by the 2 hip bones plus the sacrum and the coccyx. And there is what we call a true and a false pelvis. The false is the greater pelvis. It's a broad region superior to the pelvic brim, contains abdominal organs. And the true and the lesser pelvis is a small region inferior to the pelvic brim. It contains the urinary bladder and internal reproductive organs. So this is your pelvic girdle of the female, or the hip girdle. It is formed by 2 hip bones. This is a hip bone, 1, and this is another hip bone, 2. And it is the hip bones articulate anteriorly through the pubic symphysis, and posteriorly they articulate with the sacrum and your coccyx. Okay, the hip bones articulate with the sacrum over here through the sacroiliac joints. Okay, by the name sacroiliac joints, because your hip bone is made up of 3 bones: your ilium, ischium, and your pubic bones. Ilium with the letter I, ilium, ischium, and pubis. I said letter I because once you change this into E, it will become a structure found in your small intestine. So ilium with the letter I. Okay, so again, your hip bone, 1 hip bone is made up of 3 bones: ilium, pubis, and your ischium. ilium, ischium, and your pubis. Okay, so this is your pelvic brim over here, or your pelvic inlet. This will divide the pelvic girdle into a greater and lesser pelvis. The greater pelvis is your false pelvis, while the false pelvis or the lesser pelvis is the pelvis found below. This will be appreciated in another view. So this is the view that I am talking about, wherein you'd be able to appreciate more the false pelvis as compared to the true pelvis. So this is a mid-sagittal section indicating location of the true and false pelvis. Okay, so false pelvis, the greater pelvis found above, which contains the abdominal organs. And then the internal female reproductive tract and the urinary bladder is found in your true pelvis. The one separating your false and your true pelvis is your pelvic inlet over here. Okay? This is your pelvic inlet or your pelvic brim. So, this is your pelvic girdle. So what are the parts of each hip bone or the coxal bone? So there are three separate bones that fuse by age 23 to form a hip bone: the ilium, ischium, and the pubic bones or your pubis. The ilium is the largest and most superior, your ischium is the lower posterior part, and your pubis is the lower anterior part. The bones meet at the acetabulum of the hip bone, socket for head of the femur. So this is your right hip bone. Right hip bone is made up of three bones: ilium, ischium, and pubis or pubic bones. Ilium, superior portion; your ischium, inferior posterior portion; and your pubic bones, inferior anterior portion. So you have here the acetabulum, which makes up an area wherein it is used for the articulation of the head of the femur or your thigh. Okay, acetabulum. Your acetabulum over here is made up of the ilium, the ischium, and your pubic bones. And you have here the obturator foramen, another hole wherein other structures pass again. Now we're ready for the lower limb or the lower extremity. So the thigh bone is your femur. It's the largest bone in the body. It articulates with the hip proximally and with the tibia and patella distally. The head fits into the acetabulum of the hip bone and greater trochanter at the proximal end. The patella is the kneecap in the anterior of the knee joint. The tibia is the shin bone, the large medial and weight-bearing bone of the leg, and the fibula, it's the longest, thinnest bone in the body, and lateral to the tibia and smaller, and does not articulate with the femur. So we have here the right femur. So over here, this is your thigh, and the thigh bone is your femur. The acetabulum of the hip bone and the head of the femur articulate to form the hip joint. So this is your hip joint over here. This is your hip. This is the acetabulum of the hip, comprising, made up of the ilium, ischium, and the pelvic bones. And this is the head of your femur. So you have a greater trochanter, lesser trochanter over here, the body or shaft of the femur, and you have a lateral and medial epicondyle of your femur. This is your patella or your kneecap. Then it will have an articulation with your tibia medially, and your fibula will not have an articulation with your femur. We're done with the thigh. Now we proceed with the leg. So the leg bones include your tibia and your fibula. Your fibula is lateral, the mnemonic for location of the tibia and fibula. Fibula, lateral. Tibia is medial. So here's your femur. It will have an articulation with the tibia. Again, your fibula will have no articulation with your femur. And the tibia articulates with the femur and fibula proximally and with the fibula and talus distally. Okay, so fibula and talus distally. Femur, tibia articulates with your femur and fibula proximally and with the fibula and talus posteriorly. The tarsus or ankle has 7 bones. Large talus is the ankle bone and your calcaneus is your heel bone. You have metatarsals, foot bones, numbered 1 to 5 from medial to lateral. And you have phalanges, toe bones. The big toe has only proximal and distal phalanges, while others have the proximal, medial, and distal phalanges. They are numbered like metatarsals from 1 to 5. So this is your right foot over here, comprising the tarsals, metatarsals, and your phalanges. So these are the different bones that will comprise your tarsals and metatarsals. So you have your base and head of your metatarsals from medial to lateral, 1, 2, 3, and 4, and 5. And then you have your phalanges. Somehow, same with the phalanges of the upper extremity, the big toe will only have 2, the thumb only 2, proximal and distal phalanges, while your second to last toe will have the middle, distal, and proximal phalanges. So these are arches of the right foot. It's not straight. Arches help the foot support and distribute the weight of the body and provide leverage during walking. So you have here the lateral and medial part of the longitudinal arch, and you have also a transverse arch of the foot. What are the differences comparing male versus female individuals? Males usually have heavier bones. This is related to the muscle size and strength. So female pelvis is wider and shallower than compared to male pelvis. This is the reason for allowing childbirth. For the aging and skeletal system, birth through adolescence, there is more bone formed than lost. Young adults gain and loss about equal, and as levels of sex steroids decline with age, there is more bone resorption than bone formation. So bones become brittle and lose calcium. Fractures are expected once individuals experience trauma, vehicular accidents, or even with fall. So what are the types of fractures? So a partial fracture is an incomplete break or a crack. You say that the patient has a complete fracture once the bone is broken into 2 or more pieces. So it's a closed or simple type of fracture if the skin is not wounded or not through the skin, and it's an open type of fracture or a compound type of fracture once because of the break in the bone, the skin also breaks open. So here are some of the common fractures. Open or compound fracture, the broken ends of the bone protrude through the skin. Conversely, a closed simple fracture does not break the skin. So there's a complete fracture over here, and it's open because the skin is also disrupted over here. So there's a break in the humerus, over here. So this is a complete type of fracture. It's open, compound, because the skin also is broken. Comminuted or crumbled type of fracture, the bone is splintered, crushed, or broken into pieces at the site of impact, and smaller bone fragments lie between the two main fragments. So there are like crushed or broken smaller bones in between the bones being broken. This is comminuted. Green stick is a fracture in which one side of the bone is broken and the other side bends. Broken and the other side only bends. Similar to the way a green twig breaks on one side while the other side stay whole but bends. Occurs only in children, whose bones are not fully ossified and contain more organic material than inorganic material. So when children fall, so usually they only have green stick type of fracture. One side breaks and one side only bends. Impacted type of fracture, one end of the fracture bone is forcefully driven into the interior of the other, as you could see here in this picture. Driven forcefully into the interior of the other. Ouch. A pot fracture is a fracture of the distal end of the lateral leg, the fibula, with serious injury of the distal tibial articulation. Okay, this is pot injury. Lateral fibula bone. Okay, with serious injury of the distal tibial articulation. And Cole's fracture is a fracture of the distal end of the lateral forearm, the radius, in which the distal fragment is displaced posteriorly. Okay, so this is Cole's fracture. Pot for the fibula, Cole's for the radius. So factors affecting growth would include adequate minerals like calcium, phosphorus, and magnesium, vitamins A, C, and D, hormones that are important with the growth and the strength of the bone, like before puberty, human growth hormone, insulin-like growth factors, thyroid hormone, and insulin also are required, and sex hormones contribute to adolescent growth spurt. And weight-bearing activity will also play a factor in the growth of the bones. Calcium homeostasis. So blood levels of calcium are controlled. Negative feedback loops are important, wherein parathyroid hormone increases osteoclast activity and decreases loss of calcium in urine through controlling the kidney also, and calcitonin decreases osteoclast activity. So this is the negative feedback. The release of calcium from bone matrix and retention of calcium by kidneys are two main ways that blood calcium level can be increased. Okay, so there would be a stimulus that disrupts the homeostasis by decreasing the blood calcium level, and the receptors in your parathyroid glands will know, hey, the calcium level is decreased, and they will detect the lowered calcium concentration, which increases the production of your CAMP or your cyclic AMP. And this will serve as an input to your control center in your parathyroid hormone gene, and the gene will be turned on, which increases the release of your PTH, increase your parathyroid hormone. And the effect will have the osteoclast increase bone resorption, thus increasing the calcium level. And in your kidneys, the kidneys retain calcium in blood, excrete phosphate in urine, and produce calcitriol, thus also increasing your calcium level. Once there is decrease in the calcium level because of the stimulus, and it will be detected by your parathyroid gland cells, it will have a feedback wherein it will increase calcium through effectors your osteoclasts, and kidneys. So in response, there will be increase in blood calcium level and return to the homeostasis when the response brings blood calcium level back to normal. So this will be a negative feedback to control the release of your calcium through your parathyroid gland cells. So this is negative feedback that is needed to control the levels of calcium. So for exercise and bone tissue, the bone is strengthened in response to use. That's why we need to we need to move our bodies so that we would be able to move also our bones. And bone resorb during disuse. Examples during prolonged bed rest, fracture with cast immobilizer, astronauts without gravity. So imagine patients who are in coma, patients who have a nerve injury that would not be able to control their movement. That's the reason why their muscles atrophy or size becomes smaller, and then their bones also are resorbed during this paralysis. So the skeletal system will have contributions to different systems in the body. So let's take care of the skeletal system so that we'll be able to take care of our body as a whole. Thank you for your kind attention, and once again, have a pleasant day.